Hi, my name is Mafo Nelly Fudub. You can call me Nelly. I'm here to talk about my workplace environment. So one of the main issue that we've been facing this year as an organization is staffing shortage and poor retention rates. And according to Hudat and Tani, it is not only an organizational level problem, it is a national problem, and a lot of other companies are facing the same issue. And this issue is affected by partly by the increasing cost of health that is not helping with the situation, resource limitation that a lot of companies have to deal with, the growing aging population, increase in patient population, and the need for nurses to care for those patients. And according to Jones and Gates, 2017, in the article, a lot of nurses are leaving the health profession into different professions like IT. So that is increasing to the shortage. So high rates, high nursing turnover rates, and poor retention in a lot of sectors of the healthcare industry is also causing shortages. So I am proposing as interventions to deal with this issue in our company is to focus on a healthy work environment, which according to Clark, a healthy work environment promotes for environmental civility and promotes comfort for the employees and retention rates. Using one of Dr. Clark's, she has a environmental health assessment questionnaire that I used to evaluate our work environment, and we scored a 48. And according to this assessment, the score 48 reflects a poor or unhealthy work environment. And for that, we really need to work on our employee empowerment and communication, which, according to not only Dr. Clark in her articles, but also according to Thang and Hudson, and also according to Purat, creating an environment with effective communication, employee empowerment, and a civil environment definitely promotes retention because it reduces bullying and hostilities, and have new employees more comfortable for staying longer. Supporting, according to Berry, some employees in an environment that is uncivil might feel low self-esteem, their mental health might be affected. So providing peer support, employee recognition when somebody does something good, recognizing that, encouraging autonomy, and providing health wellness programs that can support these employees to also to create like a work-life balance, can also promote retention and encourage our employees to stay longer with us. According to Brooke and her colleagues, they did a systemic review of interventions that promote the retention, and one of the points that they brought out was orientation time. That some employees find themselves on the unit without getting adequate orientation, without being adequately acquainted with the environment and the cultural policies and procedures. And when they're unable to do their job effectively, they get frustrated and they're more likely to quit. So so those are some of the things that that can help. And why can am I giving these interventions? How helpful it is. It is good for business. It will reduce in the cost of hiring, according to Porat. If you know, when we have a high when high turnover rates, we are hiring employees all the time. We're spending on orientation, frequent orientations increases cost. So if we have a good retention of our employees, it will reduce that cost. It will improve staffing ratios. Poor employee retention, you have lesser nurses working on the unit, and even the older nurses will could quit because they keep working short, according to Harming. So improvement in retention would improve staffing ratio, and also improvement in a healthier workplace will improve that staffing ratios, improve quality of care, overall quality outcome measures, and according to Clark, better ratios will improve the health of the environment and of the workplace, and promote overall growth of the company. The scope, current staffing ratios are poor. We have a rehab unit with 2 nurses, 4 nurses assistant, and with 50 patients. That's why we have seen increased rehospitalization and increased falls and increased nosocomial infections. So the goal is to have better staffing ratios. We will increase orientation time from the 1 to 2 weeks that we have right now to, we're hoping to increase it to 3 weeks to 2 months for new nurses. Current outcomes are poor with the high rehospitalization. So with these new interventions, we hope to improve projected outcomes and benefits in terms of cost reduction, and in terms of customer service, customer satisfaction, patient satisfaction, hospital satisfactions, and census in general. Because when the patients are not satisfied, they report it, and or when we keep sending the patients back to the hospital, those hospitals are less likely to transfer their patients to us for rehabilitation. So that that is the overall benefit. People that will be affected by this new program or interventions: the nursing department, the financial department. The nursing department will be greatly affected in terms of staffing ratios and education. The financial department, human resources, and all. Now the team for this change, the administrator will be leading it, with the director of nursing, the assistant director of nursing, the staff education, the educator, especially during orientation, promoting that effective communication. That is really, really helpful in reducing hostilities on the unit and promoting the comfort of new employees. The unit managers will be key players in continuing with the daily education of their staff on the unit, and human resources will work on the staffing ratio with the staffing coordinator. I'm hoping to communicate this by planning a town hall meeting that we can discuss with the whole team, and having posters on the units, having nurse managers to continue reinforcing interventions with the staff, especially the effective communication in intervention, and quarterly reviews of the plan to see if we need to add or subtract something. Like every new thing, we have to think about costs. Yes, there will be some costs at the beginning, but I'm hoping that the costs will with the improvement in quality and outcomes in the future, that will kind of cover the costs, and expenditure. At the beginning, we might have need to cut down on some other expenditure to meet the increased orientation time, or we might have some employees that might resist, and we might need to let go of some employees that are too hostile and or resisting, so that we can establish some other employees with a different culture or better culture on the unit to and reduce the hostility and improve the retention of our new employees and the old employees that are willing to accept change. Thank you. And these are the resources that I use, the references that I use for this project. Thank you so much.